Hi, I'm Gupta. I'm a board-certified plastic surgeon, medical director of Gupta Plastic Surgery here in San Diego, California. Welcome to the website. In this section, we answer some commonly asked questions that we see on a day-to-day basis. A significant part of my practice is breast reconstruction after patients have surgery for breast cancer, and certainly something that we see every day here. If you have been diagnosed with breast cancer, or if you have any friends or family who have been and they're considering surgery, it's important to know that they have several options available to them. Assuming that they've chosen to have a mastectomy, have the breast removed, whether it be one side or both, there are several options available to every patient. Whether or not the particular procedure is the best option for them can only be determined after a full discussion with a board-certified plastic surgeon. In general, they're looking at one of two options for reconstruction of the breast after a mastectomy. That's either using an implant or using their own tissue. Again, depending on each particular case, the general surgeon will more than likely remove the breast but leave all of the patient's breast skin behind in what's called a skin-sparing mastectomy. Some cases they can even spare the nipple in a nipple-sparing mastectomy, but that decision is made based on the actual type of breast cancer the patient has. The plastic surgeon's job then is to take the extra skin that's left behind and fill it with something to make a new breast. And of course, either do one side or do both to make them symmetrical. And the two options, therefore, to fill that empty skin are using the patient's own tissue or using an implant. Each has its own advantages and disadvantages. Using the patient's own tissue is probably the best aesthetic reconstruction we can do in terms of the natural look, the natural feel, matching the other side if the patient doesn't want both mastectomies done. Then using her own tissue is a better option in that regards. And that tissue can come either from using the extra skin on the back underneath the bra line, or we take some tissue on the back, the muscle underneath, and we tunnel all that tissue through the armpit to the breast to fashion a new breast shape, put that all underneath the skin that's left behind from the mastectomy, and we can make a new breast. Sometimes, depending on how much extra tissue the patient has and the size of the other breast, sometimes we add an implant in at the same time to make enough volume. Sometimes we can do it without an implant. That's called the latissimus flap option. And the other option that's commonly used is using tissue from the belly, where we take the extra skin and fat from the abdomen, and similar to a tummy tuck where that tissue is thrown away, instead of this, we take the tissue and use it to make a new breast. And there are several variations of that procedure. The traditional classic one is the tram flap, the TRAM, transverse rectus abdominis myocutaneous flap, where the extra skin, fat, and the muscle underneath are taken from the tummy, transferred up to the breast, tunneling that up to the breast to make a new breast. Since then, with the advent of microsurgery, there's other techniques such as free trams, which spares more muscle from the abdomen, so less risk of complications. There's the DIEP, the deep inferior epigastric perforator flaps, and there's the SIAP flaps as well. All those are described pretty much in detail on my website, but all of them use the abdominal tissue to make a new breast. And it can be done on one side or both. Again, the advantage is it's a natural, healthy-looking breast, healthy-feeling breast, feels like her own tissue has a natural shape. The major disadvantages are we have to operate elsewhere on the body to get the tissue from, which increases the operative time, increases the recovery time, increases the amount of complications. The alternative option, and as well, we're also limited in how big a breast we can make based on how much extra tissue the patient has. Sometimes patients who are, for example, 5'4" and weigh 90 pounds, they're not going to have hardly any tissue available to do such a reconstruction. The other option that we look at is implant reconstruction, where we can actually use a breast implant to make the new breast. We use that implant to fill inside the breast skin that's left behind after the mastectomy and fashion that with some extra tissue to make a new breast. Often we need to do that reconstruction in 2 stages. Often we choose to put that implant underneath a layer of cadaver tissue or the patient's muscle on the chest, and that tissue first has to be stretched to create room for a large enough implant to make the breast reconstruction that the patient wishes, or for her desired size. Sometimes if there's a good amount of tissue already there and the patient doesn't want a very large implant, we can do that in one stage with a single stage breast implant reconstruction. Again, the decision of whether it's 2 stage or 1 stage depends upon consultation with the patient and their individual desires and tissue quality. The implant reconstructions are generally shorter operations, much shorter recovery time than tissue reconstruction options. And symmetry tends to be a little better when we're doing both sides because we can use the same implant on both, which makes them more symmetrical. Some of the disadvantages associated with implants are they're not as natural looking and feeling as your own tissue. They are a little bit more youthful looking, more full, more protuberant, more projection, but they are a little firmer than your own tissue. Implants don't last forever. They eventually need to be replaced due to scar tissue forming around the implant, but hopefully, if you're lucky, that's not for about 15 to 20 years. The implants always have a risk of infection as well as a foreign object in the body. So the patients need to be put on antibiotics at the time of the surgery and anytime they have any major dental procedures where there's a risk of bacteria floating around in the bloodstream that can deposit on the implant. As a foreign object in the chest, the body will form scar tissue around the implant, which is generally very soft, but over time can get very thick and painful, which is one of the reasons patients need to eventually have implants replaced. There's lots of different types of implants available, different textures, different sizes, different shapes. All of that can be discussed with every patient at the time of consultation to decide which is their favorite type of implant, which is the best one for their particular desired breast result from reconstruction. Generally, those are the options available, and certainly something that we discuss with each and every patient that we see in the office. If you have any other questions at all, we're happy to see you here in the office. Certainly call for an appointment, 858-621-6000, or visit our website at www.guptaplasticsurgery.com. And I look forward to meeting you and discussing which options are best for you. Thanks very much.